आज का बहुत ही इम्पोर्टेंट टॉपिक है हाउ टू रिड्यूस कार्डियोवैस्कुलर रिस्क। आप तो जानते होंगे निरंतर आए दिन लोगों को हार्ट अटैक होता है, हार्ट से संबंधित परेशानियां होती हैं। तो इसी के बारे में आज का ये टॉपिक है। डॉक्टर IGIMS पटना से हैं और अगर आप भी अपने सेहत के लिए जागरूक हैं तो हमें लाइक, सब्सक्राइब एंड फॉलो करें। सुनते हैं।
So today we will discuss how to reduce the risk of cardiovascular condition, because cardiovascular system disease is very important in India, and this is the major cause, leading cause of death in Indians. So cardiovascular system is formed by the heart, blood vessel, and the blood. The heart is the most working organ of our body. It pumps almost 4 to 5 liter blood every minute during the rest. It supplies the nutrients and oxygen-rich blood to all body parts, including itself. The coronary arteries surround the heart. It keeps the nourishment with the blood. When you see the heart, the structure, the supply of the heart, the blood vessel, then the capillary and the venule system, which is there for proper circulation of the blood. So coronary artery itself supply the blood into the heart. So what is atherosclerosis? That we should understand. When there is fatty deposit that is called plaque build up within the artery become narrow, and this is atherosclerosis. When it occurs inside the coronary artery, heart does not get sufficient blood supply, and this condition is known as coronary artery disease and coronary heart disease. And when there is rupture of these plaques, that cause heart attack. So what is coronary artery disease? It is simply the heart disease that form the heart condition. And in coronary artery there is supply of heart blood supply of heart is impaired because of the plaque formation or plaque rupture, and because the narrowing of the coronary artery, patient develop the chest pain or chest discomfort during walking. So what is the status of cardiovascular disease in India? When we ask these questions, it is not the leading cause of death in India. Nearly 24.8% of all death in India are because of cardiovascular disease. Ischemic heart disease or heart attack and a stroke are the predominant cause, and it is responsible for more than 80% cardiovascular disease in India. So worrisome part is that in comparison with the people of European country, the cardiovascular disease affect Indian at least a decade earlier than the most productive midlife. For example, in Western population, if 23% of cardiovascular disease occur before age of 70, in India almost 52% of death is because of coronary artery disease. So what are the risk factors for coronary artery disease? What is the modifiable risk factor which can be altered, like smoking, which cause the heart disease, other modifiable risk factor as diabetic, the high cholesterol level, overweight, obesity, physical inactivity or low fitness, unhealthy diet. That is very important. And some are fixed risk factors. You cannot modify this, like kidney disease, family history, increased age, low socioeconomic or educational status, male sex, obstructive sleep apnea syndrome, or psychological stress. These are the fixed risk factors. So how we can prevent the coronary artery disease? This is very important to understand, because prevention is better than the cure. Almost the first important thing is there should be a healthy lifestyle for the person to prevent the coronary artery disease. A diet emphasizes intake of vegetables, fruits, legumes, nut, whole grain, and fish is recommended to decrease the atherosclerosis heart disease. Replacement of saturated fat with dietary monounsaturated and polyunsaturated fat can be beneficial, and a diet containing reduced amount of cholesterol and sodium can be beneficial to decrease the atherosclerosis heart disease. So how we can prevent? According to European Society of Guideline, we should take less than 10% of saturated fat of total energy through the saturated fat to reduce the coronary artery disease. We should avoid trans-saturated fat, and we should take less than 5 grams salt per day. And we should take more fiber, like at least 30 to 45 grams of fiber per day. We should take more and more fruits, almost 200 gram fruits we should take per day. And the vegetables should be also more than 200 gram per day. So more vegetable, more food, and fish. If you are non-vegetarian, in that condition, fish at least 1 to 2 times per week is also beneficial. 30 gram of unsalted nut should be taken per day, and consumption of alcohol should be in moderation or it should be avoided. Sugar, sweetener, soft drink, alcohol, beverage consumed high should be avoided. So what we are eating, we should look before what we eat. Like we should eat a lot of grain product, a lot of fiber, low fat. That is very important. Use less fat meal like chicken and fish, and we should avoid mutton, and we should avoid also the ghee and other fatty diet, and limit your intake of food containing the calorie and low nutrition. We should take the food which contain low calorie and high nutrition. That is important. And we should take less salt. We should take less and less alcohol. That is very important. We should avoid the egg yolk. The yellow portion of egg contain high amount of cholesterol, so we should avoid that. We should avoid the fatty meat, the organ meat, the butter chicken, butter fried fish. These are these things should be avoided. And we should avoid the milk fat also, like desi ghee, butter, cheese, malai, rabdi, khurchan. These contain high amount of fat, and that also increases the weight also. So we should avoid this, and we should avoid the hidden fat like bakery, biscuits, patties, cake, pastries. And we should do regular exercise. Regular exercise must, and these exercise should be isotonic because exercise increases the good cholesterol, the HDL, and it also reduces the LDL. So regular exercise, at least 30 to 40 minutes per day is recommended, and it should be done regularly. Like swimming, cycling, running, jogging, these are very good exercise, it should be done. And the other important thing is exercise should be done regularly. At least 150 minutes per week is recommended as per ACC or AHA guideline. And we should quit smoking. Smoking is one of the risk factors which increases the risk of heart attack almost 2 times. And merely by avoiding the smoking, we can prevent the coronary artery disease. As well as smoking also increases the risk of hypertension. So we should avoid smoking. And there is also concept of second-hand smoking. Some person is smoke, the other person who is nearby to him is also get exposed with the smoking. So it will also, we should also avoid second-hand smoking. Those person who used to smoke should be smoke in secluded place, and quit smoking is must, and that should be supported by the society also. So that one of the important factor we should control. The controlling of blood pressure is also very important. Blood pressure, the checking of blood pressure should be done at least once in a year if patient is more than 35 or of age, and if high blood pressure is there, it should be controlled, and patient should take medication regularly, and whether after taking medication the blood pressure is controlled or not is also very important. And the person who is hypertensive should also do more and more exercise. He should reduce his weight, and he should take diet which is proper for healthy lifestyle. And salt restriction is also recommended. And for diabetic person, regular checkup of the sugar level, the control of sugar is very important. And similarly, the diabetic patient should do more and more exercise. His blood pressure should be under control. He should take the statin or cholesterol controlling medicine to prevent heart disease. And control and regular control and strict control of blood pressure is very important, and diabetic persons should do diet, weight, exercise like that. And the management of stress is also important. Negative stress is not good for your overall health. Some person cope with the stress in an unhealthy way, like used to overeating, drinking, smoking. All these lead to unhealthy lifestyle. Rather, finding better way like doing physical exercise, relaxation exercise, or meditation is also helpful in managing the stress, or also reduces the risk of heart attack. And getting regular health screening is also important. If there is history of heart disease in the family, or if some person is prone for heart disease, if some person is obese, if some person is more than 35 or even after 18 years of age, the regular health screening is important for hypertension, for blood sugar, for kidney function, and for other activity also, whether patient is healthy or not. So regular health screening should be done for diabetes, and regular health screening also should be done for cholesterol level, particularly in high risk person if there is heart disease, family history of heart disease, as well as any person over the age of 35 or 40 should undergo at least once the cholesterol level checking. And regular health screening is also important. If cholesterol level is very high, if diabetes is there, should be treated properly. So adhere to your medicine and listen to your doctor. That is very important. Thank you.